Have you ever thought of buying an electrical toothbrush, but you're always worried because you have sensitive gums, your teeth are very sensitive, as a result you stick to manual toothbrushing? Well, here is some points to consider on why you should choose an electrical toothbrush. And I'm gonna give you electrical toothbrush that are specialized for sensitive teeth. So let's get to that straight away. Number one is Oral-B Genius XL Limited. This toothbrush has a pressure sensor built in, which is great to identify if you're brushing too hard. The brush will notify you saying that you're brushing too hard, which helps protect people from sensitive gum, putting too much pressure on their gums/teeth. It has 6 cleaning modes and one specialized for sensitive teeth. Number two is Philips Sonicare ProtectiveClean 5100. This electrical toothbrush has adjustable intensity settings: low power, high power, medium power, like that. And it has gentler brushing experience, which is also great for people who have sensitive gums. It also has a built-in pressure sensor that impulses alerts you if you're applying too much pressure, which again, it's very good for sensitive gums. You don't want to put too much pressure on your gums. Number three is Oclean X Pro Elite. This toothbrush has 32 whopping intensity levels and 4 brushing modes, and which is great for users to match their user needs. It has a very long battery life due to its price point, and its very good appealing design. So there are many different types of toothbrushes, but these are the 3 that I found so far. Obviously there are many different types. We're not going to talk about all of them in this video, otherwise this video will be too long for that. I'm just giving you guys a rough overview of what electrical toothbrushes to consider buying if you have sensitive teeth. And you should aim to use electrical brush over manual, because by using electrical toothbrush you remove more plaque dirt compared to manual, because with manual it's not really as good when effective for cleaning your teeth. So I recommend using electrical toothbrush even if you have sensitive gums. As long as you get a brush that's specialized for that, then you should be fine, as long as you brush carefully. So here are some tips for using electrical toothbrush with sensitive teeth. Make sure to select the appropriate mode for it. Like, there's different types of modes. The mode that says sensitive teeth, select the mode that shows sensitive teeth for gentler cleaning, and make sure to use soft bristle brush heads. Make sure that the brush head has soft bristles to minimize the irritation of the teeth and gums. This is very important. Try to get a brush head that is soft, is not too hard, it doesn't put too much force onto your teeth or gums. And be mindful of the pressure. Even with the brushes having built-in pressure sensors, sometimes it can be very difficult to tell obvious by certain brushes, but obviously you have to try and be mindful of how much intensity you're putting onto your gums, and because applying too much work is not good, because the electrical toothbrush does the work for you. As we said, if it's manual toothbrushing, then you have to do it yourself, so keep that in mind. And make sure to regularly visit the dentist to make sure that your oral health and your issues are met. And yeah, so overall these are the 3 brushes and tips I recommend. And now we're gonna be answering some questions that you guys may have. So, are electrical brushes good for sensitive teeth? Electrical brushes with soft bristles and sensitive modes within them built in are gentler on the teeth and gums compared to manual brushing. That is true, because with manual brushing there's a risk of you pushing it too hard or brushing too long or something like that, and as a result you may not even notice. With these advanced technology electrical toothbrushes, they're actually better for your sensitive teeth than manual, if you'd be surprised. So what are some aspects that you should look into when buying an electrical brush for sensitive teeth? Well, you should look into brushes that have soft bristles. Soft bristles meaning the brush head should be soft, built-in pressure sensors, multiple intensity levels, and it should have mainly, most importantly, a sensitive mode um to prevent any pain that you may have after brushing your teeth. Which is better for brushing your teeth, sonic or oscillating toothbrushes? Well, I think based on that, sonic toothbrushes, for example Philips Sonicare, are often my type of thing. Because why? They vibrate gently, like less strokes per minute, while oscillating toothbrushes, typically like Oral-B, for example, are effective if used with soft bristles head. So Oral-B can work, but you have to use it with a soft bristle. But overall, Sonic is better for sensitive teeth due to the lower vibration intensity. Can an electrical toothbrush um, cause more sensitivity? If you do not um, brush properly, such as applying too much pressure, using hard bristles, then it can be a problem if you do those things. And now, men, so yeah, those are some of the questions that you guys may have. And now, some of you guys have been saying what type of toothpaste I use. Well, I use Sensodyne. Because why do I use Sensodyne? Because it's a special toothbrush. Sensodyne is a dense delising. I don't know how to say this term, but dense delising toothpaste. I mean, so yeah, the toothpaste I use is Sensodyne. By the way, it's a dense delising toothpaste which reduces discomfort while brushing. Like, the only reason why I use Sensodyne is because when I brush my teeth with Sensodyne, I don't really feel much. Like, how does that feeling, like someone pinching me or something like that? I don't feel much of that pain after brushing with Sensodyne. Whereas use Colgate and whatnot, it feels too much breathtaking. Yes, it feels better. I mean, the smell is better than Colgate toothpaste smell is better than Sensodyne. However, I just don't feel good afterwards with it. For me, I prefer Sensodyne. It feels much more like massaging for my teeth, if that's the best way to describe it. So, in conclusion, what electrical toothbrushes do I think is best for sensitive teeth? Well, as I said before, Oral-B, Philips Sonicare ProtectiveClean 5100, also Oclean X Pro Elite. These are some examples of electrical toothbrushes. Of course, I'm not going to put it down in the description or pinned comment because there's no point of me. I don't really have any affiliate links or anything special like that to obviously do. But however, I have some other links that you guys may consider checking out. For example, I've created a dedicated checklist on my website. Um, on my website, that checklist will give you a rough overview of hygiene tips to consider daily, weekly, monthly. It gives you tips like a reminder. If you guys get it, then you get free coaching with me on your first time when you buy it. And it's great for children. It gives you everything you need to consider in just a Microsoft Word PDF, bullet points. It gives you statistics. It's like a book basically, like a book, but it just gives you information straight away. Like you don't have to keep reading on and on. It's just bullet point answer like that. So it gives you like that. So do consider checking it out. Is in the description / pin comment. And yeah, so this checklist is very good for people who want to improve their oral health, hygiene, and stay in shape and minimize the chances of worrying about sensitive teeth / gums. And now, speaking of tooth sensitivity, here are some things to consider when having tooth sensitivity. Is brushing too hard. Make sure to not brush too hard. And yeah, tooth sensitivity can be caused by many factors. For example, gum recession. It can be caused by gum disease or aggressive brushing. Um, there are many different things. Acidic foods or drinks like sodas, wine can destroy your enamel, which is basically the outside part of your teeth, the white stuff basically. And if you keep grinding your teeth, like keep trying to bite like on your teeth, it can wear down the enamel over time, which is the main part. If you don't have the enamel, you can find it quite painful when eating food in general. So what are some treatments for sensitive teeth? um what I recommend is, if you for sensitive teeth, I recommend Sensodyne. Why do I recommend Sensodyne for sensitive teeth? Because why? It has ingredients like potassium nitrate, um, stannonous fluoride that that block that prevent the pain signals from traveling across your nervous system, which is a great way. Which is why I use sensitive teeth. There's many science backing it up as well. Even my doctor had told me to use Sensodyne. I still use it to this day. And yeah, that's why, because of these ingredients, it makes it feel like this toothpaste is really good for it compared to other brands that you may see like Colgate. Or not to hate them or anything. They're all good, but I'm just saying I prefer Sensodyne more. It's just a little bit better for me. It depends on your teeth, and some people are different. And make sure to have good oral hygiene, brushing twice a day, flossing, using fluoride mouthwash. Make sure to do all those things. As I said earlier, do consider checking out my checklist where I give you tips about all these things. And make sure to uh, um, brush gently and use fluoride toothpaste. Very important. Make sure the toothpaste contains fluoride. Try and use a mouthwash as well if you can, which is great if you want to prevent tooth sensitivity. And try and limit acidic foods and drinks. Drink water. If you do consume acidic or sugary stuff, drink water afterwards. Visit your dentist regularly. My checklist contains that, when you should visit the dentist. So do consider checking that out again. This checklist is very useful. It gives you bullet points of everything I'm saying here, but in like a simple format for you to follow very easily. And try to avoid teeth whitening products, because sometimes they can cause you sensitivity. So yeah. So some questions that you guys may have asked me before is, why does my teeth suddenly like feel sensitive. Like, why? Well, it can happen for many factors. For example, enamel erosion, gum recession, cavitation, cracked teeth, or dental. Like, if you went to the dentist before, like, they must have done something to your teeth, like got it out or something, or applied something to it. So that could be some of the reasons. Or maybe you consume too much acidic foods, brushing too hard. Again, this is a common habit of people, brushing too hard, or using whitening products. You know, those whitening products in my last video I was talking about, can electrical toothbrushes whiten your teeth? Like, no, they can't. They're not bleaching products. They're just a cleaning product, not a bleaching thing. So try and avoid whitening products, those bleaching products that you may find to try and whiten your teeth more than the natural state. I don't recommend you do those things because it can increase the chances of you getting sensitive teeth. So tooth sensitivity can be caused by many factors, as we obviously talked about. How do you guys know if you have sensitive teeth? Well, there are many different signs, but some of them include you may feel you may have some pain from eating or drinking hot, cold foods, or breathing in cold air, or something like that. So yeah, can sensitive teeth go away? So for example, my friend used to have sensitive teeth, and he used to ask me this question, like, will they go away on this own? It used to really bother him. It used to annoy him. It's like someone was pinching on him indirectly. Well, sensitive teeth um, can go away on its own depending on how much damage has been caused. However, long-term sensitivity uh, usually require treatments via dentist. So you need to visit the dentist. If long term, short term, yes, it will go naturally as your teeth start growing back, but the chances are very low, if you know. So yeah, sensitive teeth can be a sign of a problem. For example, it can indicate enamel erosion, cavitaceous gum disease, or a cracked tooth. So yeah, those are some indications. The best toothpaste for sensitive teeth, again, Sensodyne. If you want, you can use Colgate Sensitive Pro Relief or Crest Gum. Like these, as long as the toothpaste contains potassium nitrate or fluoride, then it will help block the pain the pain going, the pain, yeah. So it block the pain from you feeling the pain. If you have sensitive teeth, I recommend you go to the dentist because dentists can apply fluoride and gum grafts to eliminate the sensitivity. They have different tools and whatnot. We're not going to go through that, but that's for them as well. So, what foods can help with sensitive teeth? Well, dairy products, because they have calcium. Some may have vitamin D fortified in them. For example, milk, yogurt, cheese help strengthen your enamel, which is the outer layer of your teeth, by the way. And if you're vegan, for example, you may consider leafy greens or almonds. They are also very good for sensitive teeth. Does salt water help with tooth sensitivity? Well, if the water is warm, salt water can reduce inflammation and strengthen gums, which as a result will help with sensitivity, but although it's not guaranteed on its own. But if you were to do that, I recommend you mix around 1.5 tablespoons of salt in a glass of warm water and then rinse it at least twice a day. So don't forget that. My checklist also has these bullet points. So yeah, everything I'm saying is basically on my checklist. So how do you prevent your teeth from becoming sensitive? Well, if you want to minimize the chances of that happening, make sure your brush head is soft bristled. Use fluoride toothpaste like Sensodyne. Some Colgates also offer that. As long as it contains fluoride and potassium thing, then it should be fine. Try and minimize acidic foods and drinks, and get regular dental checkups, exercise regularly, do all the good habits that everyone's been talking about. Brushing too hard can cause sensitivity. It can irritate the gums. It can wear down the enamel over time, especially with aging. So always brush gently. Yes, if you're stressed, it can cause sensitive teeth, because by um, stress can lead to many different things. It can lead to the wear down of the enamel. So yes, outer part of your teeth. Try and avoid sugary drinks like soda, energy drinks, alcohol, because these can over time erode, destroy the enamel, which is the outer part of your teeth, if you're not careful, if you do it too much. Now, another dying question that you guys had is, if I have sensitive teeth, if I already have sensitive teeth, can I get my teeth whitened? Well, you can use whitening products. However, there's a catch to it. I would not recommend you do that, because number one, you're already facing pain for sensitivity. Why would you want to use a whitening product? A whitening product is just going to make your teeth even worse, more than it already is. So I recommend using a toothpaste that's specialized in distinazing, that's the term, which can help, but it's not going to make your teeth whiter than its natural state again. So I recommend you go to a dentist and ask them for options. So, does fluoride help with sensitive teeth? Yes, fluoride does help with sensitive teeth, because it it gives you it strengthen. My voice is gone. It makes the enamel stronger. Basically, it reduces sensitivity on your teeth and protects it against decay in the long run. So I recommend getting toothpaste that contains fluoride. So what is the best mouthwash for sensitive teeth? Well, there's many different types, but I'm just gonna bullet point it. Um, Colgate Sensitive Pro Relief is one of them. Although I wouldn't recommend mouthwash for I never really used a mouthwash, to be honest with you, so I'm not really don't know really much about it. So when should you see a dentist about if you have tooth sensitivity? Well, if your sensitivity lasts a few weeks or worsens, then you should obviously see a dentist as soon as you can. Like you have pain, swelling, or bleeding gums, then you should try and see a dentist. So yeah. So these are some of the questions that you guys may have want to ask me or may have asked before. So yeah. So in conclusion, I know this video is quite long, but I wanted to cover this topic in depth and in detail. So I don't want to like break down the video and you guys have to watch it. I just want to do it in one video so you guys can learn everything that you need to know about the particular topic that I'm covering, because I want to make sure that it matches with that. I don't want to have to break it down, and it's very confusing for me to break down topics because I get confused myself. So I like to do it all in one video. So anyways, I hope you guys enjoyed this video. Do consider liking, subscribing, and sharing with other people so they don't forget about today's dental tips and hygiene. And make sure to check out my website, check out the links below, and do consider supporting the channel at the same time. I hope this video gives you an outline on what you should do about tooth sensitivity and what electrical toothbrush you should consider buying or investing in if you have tooth sensitivity. Do let me know down in the comments about what electrical toothbrush you're using and what you're doing to try and prevent tooth sensitivity. If you guys have any questions, do comment down below, and I hope to see them. And yeah, I hope to see you soon. Goodbye.